Is modern medicine helping us live longer and healthier?
Wegovy helped us lose weight and keep it off.
Or is there maybe a darker, more sinister agenda? Perhaps a longer but sicker life? Big pharma, big food, the mainstream media, medical professionals, the government.
I don't want a damn balloon going across the United States.
I think that just about covers all the main culprits. Yes, is big pharma, big food, the mainstream media, medical professionals, and the government acting in concert to spew propaganda in an effort to make us all sick. Let's go back to January 1st. It's typically the day where many people, at least for a few days, muster up the strength to hit the gym, make a meal plan, get better sleep, to say that this is the year I'm finally gonna get healthy. Now, curiously, that same evening, CBS 60 Minutes airs a segment about the obesity epidemic ravaging the United States.
Dr. Fatima Cody Stanford, an obesity doctor at Mass General Hospital, an associate professor at Harvard Medical School, says common beliefs about obesity are all wrong.
It's a brain disease.
It is?
It's a brain disease. The number one cause of obesity is genetics. That means if you are born to parents that have obesity, you have a 50 to 85% likelihood of having the disease yourself, even with optimal diet, exercise, sleep management, stress management.
Okay, this face, Leslie Stahl's face, is that not the look of, I don't know about that, man. But regardless, if obesity is in fact a genetic disease and nothing we do, eating right, exercising, sleeping well, does anything to help, the only logical conclusion we can draw is that the solution can only be medication.
The drug Wegovy that you inject yourself once a week with something like an EpiPen.
What the medication does,
it's part of a new generation of medications that brings about an impressive average loss of 15 to 22% of a person's weight, and it helps keep it off.
So the message from the mainstream media is pretty simple. Obesity is a disease, take a drug. But is that the whole story? Let's start by taking a look at this chart, data from the CDC showing the obesity rates of American adults, which was virtually non-existent in the 1950s, is now projected to hit 50% by 2030. Get that, half of Americans will be obese in just a few years' time. Now, you and I, we may not be a well-credentialed doctor like Dr. Fatima Cody Stanford of CBS fame. I don't work at General Mass, I don't teach at Harvard Med, but it's odd though, because unless the human race experienced some kind of quantum leap in genetics, there must be something else we're doing that is destroying our metabolic health. Callie Means is a former pharma consultant and co-founder of a company that promotes food as medicine. Recently, he spoke to our very own Crystal Ball and Sagar Enjeti, and he offered this perspective.
I believe our food system is rigged, and our healthcare system stands by and profits from that.
Yes, let's first start by examining our food system. The average child is eating 100 times more sugar than they did 100 years ago. Researchers say sugar is basically as addictive or even more addictive than cocaine. Sugar activates the opiate receptors in our brain and affects the reward center. Every time we eat sweets, we are reinforcing those neural pathways, causing the brain to become increasingly hardwired to crave sugar, building up a tolerance like any other drug. Now, some of you out there are probably saying, I have really good self-control, I don't drink soda, I don't eat candy, ergo, I don't have a sugar problem. But oh yes, you just might. Are you a fan of barbecue? A quarter cup of barbecue sauce has on average 16 to 20 grams of added sugar. What about salad? That's healthy, right? Well, oftentimes, light salad dressings replace fat with sugar. For example, 2 tablespoons of this light honey French dressing has 11 grams of added sugar. You think you're getting your day started off right with multi-grain cereal? Although it may not have bright colors, chocolates, or marshmallows, many popular brands of multi-grain cereal have between 6 to 14 grams of added sugar per cup. Think about it. If you are a food industry executive, bonuses on the line, shareholders demanding astronomical growth quarter after quarter, what do you do to get a leg up on your competitor? Well, you add sugar to your products to make them more addictive so people buy yours and not your competitors. And then they try to one-up you, and all of a sudden, sugar is everywhere. But it's not just sugar.
You know, the foundation of our diet, and it's really taken me a while to even understand this. We know our diet's bad, but the foundation is added sugar. It's processed grains, and processed grains didn't exist until 100 years ago. The processing totally changes it. It takes the fiber off.
Fiber. What is fiber? Well, it's a type of carbohydrate that is found in plant-based foods such as fruits, vegetables, whole grains, nuts, and seeds. According to the Mayo Clinic, eating a high fiber diet helps you maintain a healthy weight and lowers your risk of diabetes, heart disease, and even some types of cancer. But for some reason, fiber has almost completely disappeared in a lot of our most popular food products you might buy thinking it's full of fiber. Cream of wheat cereal, it's got the image of a wheat stalk right across the top. But if you go to the nutrition label, it's got almost no fiber. Uncle Ben's whole grain brown rice. Somehow it's got whole grains, but if you go to the nutrition label, little to no fiber. Nature's Harvest white made with whole grain. Once again, whole grain all over the packaging, but little to no fiber. So while many of us have been told over and over again about the benefits of eating fiber, sometimes known as nature's superfood, almost nobody is getting their daily dose of dietary fiber. According to the NIH, only 5% of people in the US meet the Institute of Medicine's recommended daily target of 25 grams for women and 38 grams for men. Why? Because the food industry isn't incentivized to make food healthy, it's incentivized to make food addictive. Many of these ultra-processed foods are almost pre-chewed for us. They melt in your mouth immediately. There's no protein, there's no water, there's no fiber slowing them down. It's going to hit your taste buds and light up your reward and motivation centers of the brain immediately. Then there's a secondary hit of dopamine when it gets absorbed into the body. My goodness, over the last half century, the R&D divisions in these food companies have morphed into narcotics laboratories. They've found a way to hack our brains and make a killing, both figuratively and literally. I mean, because of all the food that we've been eating, some of it criminally mismarketed, half of the country is now sick. And guess who gets to play hero?
Common side effects are nausea, diarrhea, vomiting, constipation, stomach pain, headache, tiredness, upset stomach, dizziness, feeling bloated, belching, gas, stomach flu, and heartburn.
That's right, the healthcare system that includes healthcare services, pharma services, payers, manufacturers, and providers. According to market research done by McKinsey & Company, profits across the entire healthcare industry are projected to skyrocket from $558 billion a year in 2021 to almost $700 billion by 2025. Now that's a lot of money, but according to Callie Means, it's not the money that's necessarily the problem, it's the incentive structure.
The problem with healthcare is that 95% of costs are interventions on people that are sick. That's how healthcare works right now. Every single institution is incentivized for more Americans to be sicker for longer periods of time. Now, I don't think there are that many evil people in the system, but that's exactly what's happening. Incentives speak. It's larger than any one person.
So not any different than the military-industrial complex's willingness to trade human lives for profit, the $700 billion healthcare industry is wholly predicated on large swaths of the population being sick. Remember the CBS 60 Minutes segment on obesity where Dr. Stanford claimed on national television that obesity is a genetic brain disease?
It's a brain disease.
Turns out, in the 13-minute segment on weight loss drug Wegovy, the only medical experts interviewed by CBS were doctors who had received thousands of dollars in consulting fees and honoraria from Novo Nordisk, the maker of Wegovy and Ozempic, and the sponsor of that broadcast. Dr. Cody Stanford herself received over $15,000 from Novo Nordisk in 2021, the most recent year for which data is available. So it's not an accident that not one medical professional in the 60-minute segment mentioned the concerning finding that for Ozempic and Wegovy patients, a third of weight loss came from muscle, bone mass, and lean tissue. It's also not an accident that not one nutritionist was interviewed about food, and no one questioned the impact of the plethora of food products that are marketed, sold, and eaten by consumers in the US, but banned in most other modern industrialized nations. It's not an accident that the program never disclosed that Novo Nordisk, together with Eli Lilly, have at least 12 more obesity medications in development, and that the two companies are spending roughly $10 million annually on lobbying. A primary focus of that lobbying is the proposed Treat and Reduce Obesity Act, which has been introduced in congressional sessions annually since 2012 and would require Medicare to cover, among other treatments, chronic weight management drugs. It is a perfectly executed game of 4D chess. Let me explain. The food industry makes billions of dollars selling food that's known to be toxic and poisonous, making millions of Americans sick in the process. The healthcare industry, in this case, gets to play hero, while also pocketing billions of dollars selling a supposed miracle drug to millions of adults and children. Both of these industries have worked out a little deal with the federal government, Congress, with lobbying money, with funding for the FDA, so that they can rewrite science and continue to sell food that is known to be toxic and poisonous. The Nutrition Coalition found that conflicts of interest on the 2020 Dietary Guideline Advisory Committee were pervasive. 95% of committee members had at least one conflict with the food or pharmaceutical industries. The most frequent and durable corporate connections were with Kellogg, Abbott, Kraft, Mead Johnson, General Mills, and Dannon. That sounds like quite the racket to me. But how is such a racket allowed to continue?
There's a three-part playbook. We went directly to the NAACP and the Hispanic Federation, very respected civil rights groups, and it was a quid pro quo. Coke paid them millions of dollars and they labeled the opponents racist. And that shuts down debate.
And according to Means, the same playbook is being used again today. Novo Nordisk is paying the NAACP to lobby on their behalf to say opponents of lifetime obesity injections such as Ozempic and Wegovy are racist. The implication is that the lack of access to a drug such as Ozempic is an example of, quote unquote, systemic racism and oppression. In addition, Novo Nordisk has also funded articles in leading research journals advocating for the government to subsidize their drugs to address racism. That is quite the playbook, but is there a solution to all of this? Because I think it would be irresponsible to simply point out all of these problems without offering a solution.
Now, there's a couple things that I think are absolute no-brainers, and I think this is the bipartisan issue of our time.
The first solution, he said, would be for the FDA to revise the recommended added sugar for kids to 0. Right now, the FDA actually recommends up to 50 grams of added sugar per day based on a 2,000-calorie diet. Means' second suggestion, the federal government should eliminate subsidies for unhealthy foods. Right now, more than half of SNAP benefits are taken by retailers for meats, sweetened beverages, prepared foods and desserts, cheese, salty snacks, candy, and sugar. Just 23.9% go for fruits, vegetables, grains, nuts, beans, seeds, and spices.
Let's reform food stamps. Again, that's a program that 15% of Americans depend on for nutrition. 10% of it goes to sugar water. I don't think we should be paying tens of billions of dollars to subsidize them for kids.
But alas, we all know the old adage, you can lead a horse to water, but you can't make it drink. And what I mean by that is I'm only here to ask questions, inform, and connect the dots. So ask yourself this: all of the technological advancements and public policy decisions of the last half century, have they contributed to promoting a longer and healthier life or a longer and sicker life? Thank you for watching the first installment of Breaking Points Beyond the Headlines. I hope you enjoyed it. Discussion, questions, feedback, have at it in the comment section below. For more of me, please take a second to check out my YouTube channel, 5149 with James Lee. The link will be in the description below. Thank you so much for watching, and thank you for supporting Breaking Points.
Hey guys, ready or not, 2024 is fully upon us now, and Sagar and I have been brainstorming ways that we can really up our game for this critical election.
Yeah, we rely on our premium subs to expand our coverage, to add staff, to upgrade the studio. We just want to give you the best independent coverage of this election, which is possible. So if you can help us out, become a premium subscriber today, breakingpoints.com, or the link is down here in the description video. It really means the world to us, and if you like what we're all about, this is the best possible way to keep us 100% independent, working only for you.